My name is Fredrick Van Pelt. I go by Rick. I'm part of Partners Harvard Medical International. I'm a director for global programs. Well, I think medical tourism is certainly an emerging field. I think it's one that has captured the attention not only of the patient consumer, but also of the insurance companies, as well as employers. I think there's a quality proposition as well as a service proposition that certainly in the United States, I think people are starting to look overseas for improvements in both. And I think, again, not knowing how healthcare reform is playing out in the United States currently, but certainly cost is an issue. And I think the large uninsured population in the United States has certainly had an impact on looking elsewhere for care. But I think, fundamentally, I think it's really about finding excellent care and going beyond quality to service and environment. And I think medical tourism is really addressing that niche. Well, generally, HMI, Harvard Medical International, was the original organization. HMI used to be we used to be part of Harvard Medical School. And 2 years ago, we became part of Partners Healthcare System, so we're now Partners Harvard Medical International, which is a mouthful. And at the time that we were HMI, there were certain permissible affiliations using the Harvard name. Harvard University is very conservative, as most universities are, about name use. And so we actually, not only because they are very hesitant to have their shield or their name used for branding purposes, but also because our model is much more one of collaboration and knowledge transfer. We tend to focus less on branding as much as it is using the name, if you will, in the context of the work we provide. So it's more factually based, the way it's used. And so I think, our mission is really to say that in the long run, it's in the interest of any organization that we're involved with internationally to develop their own brand. And so our approach is to provide the expertise that the Harvard faculty and that Partners healthcare system offers beyond care, as far as development of infrastructure and so forth, in a way that ultimately lets the organization that we're working with define themselves as a leader in their region on their own. Well, again, I think I think affiliation becomes very important at the beginning. Many countries, for example, India, where we have done a lot of projects, initially looked at the brand, the Harvard brand, if you will, as something that was of primary value for the relationships. And I think what has emerged now, and again, what we encourage, is for factual representation of the Harvard name to be used in the process of helping the organization that we're working with develop their own brand. Because in the long run, that's really what it's about. And I think more and more organizations are actually less concerned about brand than they are about the knowledge transfer that occurs from the affiliations, or the collaborations, as we call them. Well, I think one of the interesting things about medical tourism is it seems very unclear what the numbers actually are for the types of patients that are seeking care. I think my sense is that it's increasing, and I think what's emerging is a tendency to provide medical tourism in a more regional manner. So less long distance travel as much as it is about developing tourism that's closer to home, and really developing services that not only cater to the medical tourist alone, but also that start to cater for the regional and local populations. So I think, again, there's certainly cost pressures and the service element that are attracting, I think, more and more people for particular specialties where the allure of going elsewhere and the I guess the avoidance of the downsides of traveling either in pain or with potential complications is small. So for elective types of surgery, I think that those markets are definitely emerging. I would say that the experience that I've had and my interaction with people has been very impressive. I think people are engaged, and I think what I find appealing is the representation from many different industries, not only within healthcare but outside from the service industry, that are taking a careful look at what medical tourism offers and what the opportunities are. So I think my view is that the conference has been very well attended, and people are actively engaged. For me, I think medical tourism for me, I think is a critical element of healthcare delivery. PHMI tends to approach healthcare from the middle. We deal primarily with sort of the emerging middle class economies, and recognize that what we're ultimately trying to accomplish is excellence in healthcare for everyone. And again, I think that because the bar is very high for the care that's provided in the medical tourism industry, it can set an example for how care should be provided in general in any of the countries where this service is provided. I don't know if I have enough information to do so, but I guess I would say that I think there is value. Healthcare in general is fragmented, and I think to have an organization that essentially pulls together and holds together a large element of care can only be beneficial as long as it's objective and is looking out for the best interests of the care that's being provided. I guess I would say that there always is going to be a subset of patients that will travel far for different types of services. And I think when you have regional conferences, not only does it create awareness of best practices that are going on globally as an incentive for regional development, but I think, again, it's a sharing of knowledge, and it's an opportunity to really expand the patient base beyond perhaps where the populations or the patients were originally thought to come from.